watching Senior Support on your TV. My name is Debbie MacDonald Moynes, and I'm your host. I'm also a co-producer of the show, and I'm the executive director of the Prince Edward County Community Care for Seniors Association. The other community co-producer of the show is Shelley Wert, and Shelley is also the executive director of Community Care for South Hastings, and Shelley is our guest on the show today. And so I'll welcome you, Shelley, to the show. Glad that you're here.
Thank you, Debbie. It's nice to be here with you instead of behind the scenes.
Well, that's right. You're always behind the scenes. And when we're in the studio, you're making sure everything goes well and all the details are tended to and our guests have all the information that they need. But here you are on camera today on our new way of doing this with Zoom. And our topic today is to talk about the programs and services and the status of all of those things with both Community Care South Hastings, and later we'll talk about Prince Edward Community Care. So let's just start, Shelley, with you do have an office there in Belleville, and where you can serve clients, and another sub-office in Deseronto. Let's just talk about the status of the offices. Do you have them open to the public yet?
Yes, thanks for asking that, Debbie. No, the mall is open now, so we could, but we have made the decision to just keep the door locked at the present time to the public. But people can certainly come in and make a payment if that's what they have to do, or if they need to pick up a document or something. We just typically hand it out the door to them rather than having people come right into the vestibule or the foyer. And we do have the receptionist has some plexiglass to protect her, and so we can maintain the appropriate 6-foot distance and keep everyone safe, because there are other people working in the office. And so that's where we're at, and we're really trying to encourage people to use a credit card or e-transfer something, or send a check, and that prevents them to even having to come into the office, which is often better.
Yes, we really have to do things as safely as possible, don't we, during this pandemic? We're still in the midst of it. We have to be very careful for our staff, for our volunteers, and of course for our clients that we support to live at home. So it's interesting to hear what adaptations that you've made in your office to be able to do that. I know that they can receive many of your services by calling your agency on the telephone. So if a person is watching and they're wanting to have some of the services of Community Care for South Hastings, Shelley, and they call the number that is on the screen, what are the kinds of things that they can access?
Okay, right now we have been offering several of the programs throughout, but certainly I think the largest program is, of course, Meals on Wheels. We do delivery 4 days a week in Belleville and the rural area, and we have frozen meals as well that we deliver twice a week, depending on your location. And so that's one of the biggest programs, and we can easily set that up with just a telephone interview at this point. We're not encouraging any home visits. I know the regional care planners are back on the job, but again, we're trying to limit people accessing folks in their homes, both for the client's protection and for the coordinator's protection. So we can set that up by phone. We have transportation services. They're somewhat restricted for a couple of reasons. Number one is, of course, ensuring safety. So we can only have one person per vehicle. So that's difficult for folks that need an attendant, but we've got some workaround solutions for that. Also, some of the volunteers, because they use their own vehicles, their vehicle's not quite suitable. For example, if someone drives a truck or a 2-seated vehicle or something like that, that's not appropriate right now, because we're insisting that folks sit in the back seats and everybody has to wear a mask, and the usual public health procedures are in place for that. We're also doing home help, and most of our brokered workers, that's the self-employed people that do this work for us, have returned. So they're getting new assignments all the time. And of course, the maintenance, particularly mowing lawns and that kind of thing is going on as well. And some virtual programs for the aphasia conversation group and the stroke support groups. Yeah, and just calling everybody regularly to see how they're doing.
Sounds like you have lots on the go there, Shelley. Even though your office is closed to foot traffic and the public, you have lots of programs and services to help people live at home, help seniors live at home. Just wondered about adaptations that you've made, for example, to your Meals on Wheels program. Have there been things you've had to start doing differently because of this pandemic we're in?
Yeah, absolutely. I mean, again, we're encouraging absolutely no contact for everyone's safety. So the volunteer that takes the meal, I mean, number one, the volunteer is screened every time they present to pick up the meals for their route. And then they go out and the meals are put in a plastic bag, placed on a doorknob or on a table outside a door or something like that. And then the volunteer, knocks or rings a doorbell and steps back far enough. So when the client comes, certainly they can visually see them and have a little bit of a chat perhaps, but it's all with the 6 feet between them. And of course, sanitizing has become the norm. In fact, when I return to work on Mondays, I call it Welcome Back to Sanitizer Week, But yeah, it's all very touch-free, and I know folks that have major difficulties. There are, again, some workarounds that can be worked out to make it happen. So, but we were really discouraging people from going into homes, for sure.
So Shelley, let's just talk a bit more about the screener that you mentioned. You said people are screened. And so I know that you're referring to the COVID-19 screener that is released regularly by the Ministry of Health. Can you just tell us a bit more about how that screener works and when your staff would be using the screener?
Okay, well, it's used in a number of different ways. For example, if someone is calling for a transportation request, they are screened by the phone at the time of the appointment by the receptionist or the transportation coordinator, whoever's taking the information down. And then the day prior, when we call to confirm the ride, the client is again asked the questions which deal with, travel and any sort of respiratory conditions or unusual, sniffles, things that aren't related to seasonal allergies, contact with other people in their lives, that kind of thing. It's quite a lengthy list now, as you well know. And then the day of the ride, the client is again screened prior to getting into the vehicle by the volunteer. So that's one example of how people are being screened in our agency.
And you screen the volunteers as well, Shelley?
Oh, absolutely. Absolutely. Yeah. And
there's... Sorry, go ahead.
I was going to say, there's also that lovely self-assessment that's online. If people have access to the internet, they can walk through it on their own in the mornings and just make sure that they're feeling comfortable and confident that they're good enough to go out and work for the day. And if they're not, then they absolutely just call in and say, we can't do it today.
So it sounds like you're taking all the steps, Shelley, for the programs and services that are currently on offer to be as safe as they possibly can for both the clients and the volunteers. And with that said, I wonder, are you taking additional volunteers? Are you accepting new people that would like to volunteer to support your agency and programs and services?
Yes, we are. We definitely had to recruit some new individuals during the height of the pandemic because most of our volunteers are retired and most of them are over the age of 70, in fact, which is amazing. And it was suggested that they stay home and be safe. So we did have a number of folks come to us through various sources in the community to help us out during that period of time. And we screened them, to the very best of our ability without a face-to-face sort of visit. That was what we were doing. But we're encouraging new applications because by the time people apply and go through the process, it is a little bit time consuming. So, and we're definitely going to need the help.
Mm-hmm. And I know that you're certainly taking additional requests for service from seniors. Your hot meals are made right there on site by your chef that works for your agency, and I'm sure they're very tasty. You've told me how tasty they are, that you have to try and keep yourself out of the kitchen so that you're not eating all the desserts and everything. And I do know as well that the frozen meals are very good. Both our agencies use the same supplier, and the meals are delicious and really well suited for seniors. So can you just tell us what seniors might find if they had the hot meals from your organization?
Okay, well, with the hot meals, of course, it's summertime, so there's not as many soups being served. They are a couple times a week, but typically it's a salad, and then you get a full meal, which is your protein. Today, I think it is actually spinach cheese quiche, which is amazing, and some home fries, and probably a home-baked biscuit to go with that as well, and a salad. So, and then you get dessert, which could be a pudding or a tart or cupcakes or all these huge chocolate chip cookies. You wouldn't believe them. Not that I've ever tried them. But yeah, so there's always, they're a nice portion. They always smell wonderful. And yeah, they're all home cooked, which is great.
It sounds absolutely delicious, your description, Shelley. Thank you for telling us about that. Are there any final words, anything that we missed while we were talking about this today?
I think we've hit on the high points, Debbie, and I really appreciate you allowing me to speak to some of these things. But as always, just call us. Even if it's not something that we can do, chances are we can point you in the right direction so that the folks don't have to be calling here, there, and everywhere trying to find something to help them out. So, yeah, just pick up the phone, call us.
That sounds like a very good thing to do, Shelley. And I do hope our viewers will do that, reach out to your organization and find out about the services that are available to them to help them live at home. Thank you so much for being with us today.
Well, thank you.
You're watching Senior Support on your TV. Our topic today is the services offered by your local community care agency.